Hello, everybody. My name is Luke. I'm an ER nurse. I've worked for Cox Health for well over 10 years, all in the ER, done some travel assignments. At the height of the COVID pandemic, I went to New York City and volunteered to help up there. And I've worked in my own ER throughout the COVID pandemic on the front lines with the respiratory patients. I'm making this video today because it's Emergency Nurses Week, and tomorrow I'm going to be going on permanent suspension from my job. So I've had a lot of people ask me why and ask me what I think, and so I wanted to do just hopefully a brief presentation today to kind of talk about some of that and explain some of my reasons for the suspension. So I want to talk today about medical ethics. Medical ethics are incredibly important, and our focus today is going to be on autonomy, informed consent, shared decision making, privacy, and the doctor-patient relationship. So why do I want to talk about medical ethics, and what does that have to do with my suspension? I think that takes a little bit of history, and so we're going to go over some of that because I think that medical ethics are extremely important, and you can't quite understand the importance of them unless you look at our own history here in America. I know that people will not enjoy hearing all this, but there is nothing more empty-headed and insane than our present naturalization law. Currently, there is one state that is making at least a feeble effort to create a better system. Of course, it is not our own model German Republic where this good sense has taken hold, but the United States of America. It's Adolf Hitler, Mein Kampf, 1925. The Rockefeller Foundation funded a series of programs in the field of German eugenics research. Among its guarantees was that the program that employed Mengele before he became the notorious so-called Angel of Death. Its support for German eugenics continued even after Hitler seized power in 1933. The California eugenicist C.M. Gothy traveled to Germany in 1934 and returned full of praise for the ways in which the Third Reich proposed to make good on and extend California's eugenics-based efforts. Everywhere I sensed that their opinions have been tremendously stimulated by American thought. The why behind medical ethics is about where we have been as a culture and as a country and where we're going. These quotes are obviously just a little bit insightful as to the praise for America and the participation of America in violating human rights pre-World War II. Eugenics in America was a big deal. They had churches, community groups, obviously local governments, state-by-state laws that were imposing immigration restrictions, tremendous propaganda campaigns, some of which have been popularized in film. You can find some old film clips talking about the eugenics movement back in the day, as well as state legislation. And it ended up in approximately 65,000 Americans being sterilized forcefully as compulsory sterilization, where they decided who was fit to breed and who wasn't. And that went from 1907 and continued all the way up till 1981. So fairly recent history. You can see here just a few pictures of some of the stuff that went on. Obviously, eugenics and health exhibits, educating the public about eugenics, a eugenics protest, talking about whether or not people had the right to have children, and the transmission of alcoholism as well as criminality that they believed was primarily genetic. As well as eugenic certificates. A lot of this was based on pseudoscience, which we'll talk a little bit about, measuring of skulls and, eye width and weird things like that. But the belief system was primarily based on evolution. It was a naturalistic worldview that gave rise to this, that gave rise to the ability for this. Like I said, it was based on pseudoscience, stuff that would be denied or wholeheartedly rejected by the scientific community today. And it led to egregious crimes, the oppression of the poor, the disabled, the mentally ill, and ethnic communities throughout our country and in some places around the world. And it was the same belief system, the same thought and worldview that gave rise to horrible human experimentation right here in America. Obviously, a lot of us are educated about the Tuskegee experiments that went from 1932 to 1972. So some of this isn't going to be new for a lot of you, but I wanted to talk about just a little bit about it. Um, Impoverished black males who had syphilis were offered treatment by researchers who did not tell the test subjects that they had syphilis and did not give them treatment for the disease, but rather just studied them to chart the progress of the disease. It was during this experiment that it became well known that penicillin was a very effective treatment to kill syphilis, and that was not given to these people. If I remember right, it was around 400 black men who this experiment was done on. They lied to them about their true condition so that they could observe the effects of syphilis on the human body. And at the end of the study, only 74 of the test subjects were alive. 40 of their wives had been infected, and 19 of their children were born with congenital syphilis. And so, like I said, we know about the Tuskegee experiments. It's not going to be a surprise to anybody, especially in the medical community, who have been educated on medical ethics and have read about these in their classrooms. But the reality is that that is just the tip of the iceberg of human experimentation in the United States, of the stuff that we know about, right? There's a lot more, and there's a lot to talk about and a lot of examples to be given. John Charles Coulter was one of the doctors in charge of the Tuskegee experiments. Tuskegee became public. It was funded, and he worked with the U.S. government. And then he, in 1946, went to Guatemala and started doing the exact same thing. The experimentation in Guatemala lasted more than 6 decades. It was done on over 1,500 orphans, prisoners, military conscripts, and prostitutes in Guatemala, the most vulnerable people you can imagine being taken advantage of. And he was quoted as saying, "Unless the law winks occasionally, you have no progress in medicine." It's one of our great doctors. He died in 2003. So eventually, John Charles Cutler got caught, right? So what do you think happened when he got caught? When the Tuskegee experiments became public knowledge, his associations and things like that became known. Much later, his experiments down in Guatemala became known. What do you think his punishment was? How many years in prison did he spend? Do you think he got the death penalty? Let's take a look. After brutally killing people in Guatemala in the Tuskegee experiments, he went on to be appointed professor of international health at the University of Pittsburgh. He also served as chairman of the United States Department of Health Administration and acting dean of the Graduate School of Public Health in 1968 and 1969. Furthermore, he went on to become the United States Assistant Surgeon General in 1958. So as you can see, that he was not punished at all, right? More or less, he was rewarded. His experimentation on humans was disregarded, and he was promoted to the highest levels of some of the highest levels of the academia as well as our government. And he's not the only one. Let's take a look. Saul Krugman of New York University. He promised parents of mentally disabled children that their children would be enrolled into Willowbrook in exchange for signing a consent form for procedures that he claimed were vaccinations. In reality, the procedure involved deliberately infecting children with viral hepatitis by feeding them the extract made from the feces of patients infected with the disease. Krugman became the president of the American Pediatric Society. Krugman was awarded in 1938 the Mary Woodward Lasaker Public Service Award. So as you can see, especially at the time, the belief system and the disregard for human life and human rights was rampant. It was not that those things were not respected by the government. They were not respected in academia. And many of the perpetrators of some of the worst human rights abuses that have ever happened in America were rewarded rather than punished. He died in 1995. Chester M. Southam infected live cancer cells, known as, I'm going to say this wrong, HeLa cells. Some oncologist out there somewhere is going to mock me, into prisoners at the Ohio State Penitentiary and cancer patients. Sloan Kettering, which was a research facility, 300 healthy females were infected with live cancer cells without being told. The doctors stated that they knew at that time that they might cause cancer. 2 years later, the American Cancer Society elected him as their vice president. In 1963, 22 elderly patients at the Jewish chronic disease hospital in Brooklyn, New York City, were injected with live cancer cells as well. This is after he's vice president of the American Cancer Society. He continued to perform experiments on humans without their knowledge and without their consent. He went on to be the president of the American Association for Cancer Research. He died in 2002. Dr. Richard Strong, this is a little bit older, but still very, very relevant. He infected 24 Filipino prisoners with a cholera vaccine that was contaminated with bubonic plague. He did this without the consent of the patients and without informing them of what he was doing. All the subjects became sick and 13 of them died. He compensated those survivors that managed to make it through the bubonic plague with cigars and cigarettes. He became professor at Harvard School of Public Health from 1926 to 1927. He then led the Harvard Medical African Expedition. I'm sure that was just a fun expedition, especially for the locals. Lord knows what all went on in that expedition. The Stateville Penitentiary. We're almost through. We're going to go through just a few more of these, and I'll explain why. It was a study on the effects of malaria on the prisoners of Statesville Penitentiary near Joliet, Illinois, beginning in the 1940s. The study was conducted by the Department of Medicine at the University of Chicago in conjunction with the United States Army and the State Department. At the Nuremberg trials, doctors argued that ethically there was no difference between the research conducted in American prisoners and the experimentation that took place in Nazi concentration camps. The study continued at Stateville Penitentiary for 29 years. In related studies from 1944 to 1946, Dr. Alf Alving, a professor at the University of Chicago Medical School, purposely infected psychiatric patients at the Illinois State Hospital with malaria so that he could test experimental treatments on them. He went on to educate and publish papers for the U.S. Medical Service. So you can see consistently these people are in high positions, both with the government and with academia. They were often rewarded. Their human rights abuses are what allowed them to move up the ladder in academia, that the belief that human life was not valuable, especially these people. Can you imagine how vulnerable these people were, right? Psychiatric patients in a state hospital, and he's giving them malaria to test experiments on them. They had a complete disregard for human life, a complete disregard for the position they were in as physicians and educators, and just no respect at all for those who were so vulnerable. This will be our last one, and we'll move on. So J. Marion Sims, back in the 1800s, performed medical experiments on enslaved African women without anesthesia. These women would usually die of infection soon after surgery. Because of his belief that the movement of newborn skull bones during protracted birth causes trismus, he used a shoemaker's awl, a pointed tool shoemakers used to make holes in leather, to practice moving the skull bones of babies born to enslaved mothers. Also performed genital mutilation on women to control hysteria or improper behavior related to sexuality. Sims was unanimously elected president of the American Medical Association. So post-World War II, when things started to come out and it became public knowledge, the level of abuse and the horrible things that happened in the Third Reich became known, public knowledge, and believe it or not, it put a bad taste about the idea of eugenics in a lot of people's mouths. The logical conclusion of the same things that they were teaching, propagating, and encouraging in our own culture were really put on full display with the experimentation that came out of World War II, and rightfully so. I mean, they gave us credit, and I think they were right to do that in a lot of areas, because we were leading the way in this field. We were encouraging this kind of thought, this kind of lack of regard for human beings made in the image of God. And when the public began to see these things and see the pictures and the information coming out of the post-World War II era, the public perception of eugenics changed. Their experiments were still going on. Mandatory compulsory sterilization was still going on, but just not as much on a public level. They changed a lot of terms to discuss like similar ideas. They changed, eugenics became bioethics or genetic engineering. Medical journals dedicated to eugenics changed their name to the Journal of Biosocial Science. Biomography and social biology are just two to name two of them. And we brought over 1,600 scientists and engineers that committed these atrocities were brought over to the United States post World War II. How many years in prison do you think they got? What kind of punishment do you think they received for their part in the murdering and torture of thousands and thousands and thousands of people? It was much the same as the other cases we've looked at. But the public perception had definitely changed, and it was out of this black, dark era of our own history that these lights of medical ethics shine so brightly. And that's why we've gone over what we've gone over, because I need you to understand, one, my motivation, but also why these are so important. And so I want to look at a few of these just a little bit more in depth. Obviously, autonomy is one of the biggest ones that's being continually violated on a global scale. I would argue that we haven't seen this kind of human rights violations on this kind of scale since the area of eugenics in America. Autonomy, a patient has the ultimate decision-making responsibility for their own treatment. These are things that in a lot of ways, that some of these things were around prior to World War II and have been around for a while, but the importance of them and how seriously we should take them are certainly highlighted by our own dark history and mistreatment of people and complete utter disregard for their autonomy, right? One of the big things that came out of the Nuremberg trials, of course, informed consent. And there's other things to credit for that too. Some people would talk about the Tuskegee experiments and how that had an effect as well. But the voluntary consent of human subjects is absolutely essential. You think that this would be a given, right? The means that the person involved should have legal capacity. That means that the person involved should have legal capacity to give consent. Should be so situated as to be able to exercise free power of choice without the intervention of any element of force, fraud, deceit, duress, overreaching, or other ulterior form of constraint or coercion. I think the very idea that you can appropriately sign an informed consent when literally your livelihood, your ability to provide for your family, your ability to, we talk about Maslow's hierarchy of needs, those things that we just have to have, right? Those things are on the table of being taken away, right? Unless you sign an informed consent. It's crazy. It's not informed consent. It can't be done when you're under coercion, when you're under duress, when there are entities, both government and local, that are overreaching and violating this medical ethic. It just can't be done. Of course, there's shared decision making that clinicians and patients work together to make decisions and select tests, treatments, and care plans based on clinical evidence that balances risk and expected outcomes with patients' preference and values. Privacy. I will respect the privacy of my patients. This is from the Hippocratic Oath, at least some of the good versions of it. I will respect the privacy of my patients, for their problems are not disclosed to me that the world may know. And then lastly, the doctor-patient relationship. The relationship is built on trust, respect, communication, and common understanding of both the doctor and patient's sides. The trust aspect of this relationship is mutual. The doctor must trust the patient to reveal any information that may be relevant to the case, and in turn, the patient must trust the doctor to respect their privacy and not disclose this information to outside parties. An important dynamic of this relationship is that the doctor is bonded by oath to follow certain ethical guidelines, whereas the patient is not. It is important to remember that the doctor-patient relationship is a central part of healthcare and the practice of medicine. In the current situation we find ourselves, all of these things are being grossly violated. The hypocrisy of those that are on boards of directors and CEOs of different organizations is blatantly on display because they expect every one of their medical employees to abide by these principles. Yet they're violating them not just for their patients, but also their peers, right? Their very peers. You can't have a doctor-patient relationship when you're being forced by an outside entity to do something that violates that. It obviously violates privacy. We talk about, vaccine passports and not being able to go places and do things based on medical treatment, whether you've chosen to receive it or not, which has to be made public knowledge for that to take place. Shared decision making obviously is completely out the door. Informed consent, I would argue, cannot be given under the conditions we find ourselves. And this is from the Nuremberg Code, what I read there. And then, of course, autonomy is just completely thrown out the window. The importance of protecting human rights can't be understated, right? It's not going to be done by governments. It's not going to be done by medical associations. It is not going to be done by CEOs and boards of directors, right? It is you. It is us, especially if you're a medical provider. We are the barrier in between overreaches and abuses to protect the people that are our patients that are under us, right? And not just under us now, right? Our peers, the people working next to you in your department, the people that have been maybe working on the front lines with you throughout the pandemic, right? Their human rights are being violated. Their autonomy is being taken away. Their ability to give an informed consent without coercion has been destroyed. And we as medical providers have to stand up for those medical ethics. We have to stand up for human rights. And it's not going to be done by anyone else, right? It's not going to be, there's not going to be an organization that comes along that's like, maybe we're overreaching here. Maybe the people that have put these things in place, the people that have allowed this to happen, this is going to set a precedent for further human rights abuses down the road, not just now, but in the future. The things that we've done fairly recently in our history. To say that it can't be done is to be ignorant of history. To say that it's not being done is to be ignorant of what it means what those medical ethics mean. It's not a discussion about the efficacy of a particular medical treatment. This is about the principles and the morality that guide all of our medical practices, right? I could make a whole nother video about, the reasons why I made my own personal medical decisions, what I think and what I think the data shows. And that so often becomes, right, just a war of slinging mud, right? That one side posts their medical articles and they say, oh, well, this is what's going on. The other side posts their articles and they're saying, oh, everyone who doesn't believe me is an idiot. And the other person's like, no, read this. If you don't believe this, you're a science denier. It becomes madness, right? And I'm down to talk about the efficacy of different treatment options all day long. Happy to do it. But that is a completely different discussion than the violation of human rights that we're seeing right now and that we will see in the future if things aren't done. If there's anything that I was disappointed about throughout this whole thing, it was how quick my peers were to disregard any of this stuff. I mean, in a lot of places, this conversation isn't even being had. The discussion about the violation of medical ethics that's being done right now in organizations, in hospitals, on the government level, on the state level, that's not even part of the discussion. The discussions, oh, does it work? Does it not work? Should everyone get it? Should everyone not get it? Whether or not we have the right to do that and whether or not that's a violation of human ethics is not even being discussed. And I was really disappointed to see that in people that know these things, the people that don't need to watch the beginning of the video about all the unethical things that we've done as a people and as a country and how we've abused the most vulnerable in our society and murdered hundreds of them, sterilized thousands of them. And we're not even going to have this discussion on a national level, on a organizational level, on a personal level. We're not even going to talk about it. I was really disappointed when that came about. And so my decision to not apply for exemption and my decision to make my own medical decisions was one that was based on medical ethics. I felt like it would have been a cop-out to allow this kind of abuse and then file an exemption, say, well, I'm exempt this time. It's like, I have an exemption this time. You definitely have the right to do everything that you're doing, but this time I'm exempt. I can't do that, right? I feel like I have to stand up for the morality that guides our practice, that guides our use of medicine in the community, and that's definitely being violated. Um, Ultimately, I'm a Christian, and so I don't have hope in anything in this world, like, justice being done because a government or an organization says so, right? My hope is ultimately in Christ. And if you're concerned about these things, and haven't run yet to the cross of Christ for salvation, I'd encourage you to do so. 1 Peter 1:3-6 says, "Blessed be the God and Father of our Lord Jesus Christ. According to his great mercy, he has caused us to be born again to a living hope through the resurrection of Jesus Christ from the dead, to an inheritance that is imperishable, undefiled, and unfading, kept in heaven for you, who by God's power are being guarded through the faith for a salvation, ready to be revealed in the last time. In this you rejoice, though now for a little while it is necessary you have been grieved by various trials, so that the tested genuineness of your faith, more precious than gold that perishes, though it is tested by fire, may be found to result in praise and glory and honor at the revelation of Jesus Christ." That's what I hope for in my own life, and and I know that one day, every knee will bow and every tongue will confess. But until that time, I'm just trying to call people who have violated these ethics, maybe people that didn't even realize the importance and the significance of what they've been doing. I'd just call them to repentance, and I'd ask you to consider what has been done in our recent history, who has been the perpetrators of that, how they were rewarded, and to consider that we need to stand up. We need to stand up for medical ethics, regardless of, if you think that every single person 5 years old and up should be given the vaccination, right? Do you have the right and do you have the authority to do that? Do you have the right and do you have the authority to threaten people's livelihoods if they don't do that? And that's what I'd ask you to consider. Thank you for watching.